So I'm Bryson and I'll be teaching you on how to use the microwave diathermy, especially this machine, MW7S. So this machine is indicated to increase blood flow, increase metabolism, increase collagen extensibility, muscle relaxation, possible changes in enzymatic reactions, increase microvascular perfusions, accelerate cell growth and division when slow, and inhibit it when fast, alters calcium ion binding, This machine is contraindicated for acute conditions, especially this type of machine, for superficial and deep metal implants, malignancy, hemorrhage, cardiac pacemakers, pregnancy, and if there's a presence of menstruation, it is contraindicated around the low back area. It is also contraindicated for over the synthetic materials, contact lenses, impaired mental capacity, obese patients, over moist clothes, and presence of electromagnetic device near the patient. The precautions are decreased or increased sensation, circulatory problems, over the growing epiphysis of children, over atrophied, infected, or damaged skin, and exposure of the practitioner. Next. This machine has 4 dosages. Dose 1 is the non-thermal. It is used for acute cases. Dose 2 or mild heat sensation. It is used for subacute injuries and inflammation. Dose 3, moderate heat sensation for pain, muscle spasm, and chronic inflammation. And dose 4, vigorous heat sensation for increased blood flow, heating, or collagen fibers for stretching of soft tissue and for adhesive capsulitis. To use this machine, the head should be perpendicular to the area, for in this case, the low back area. You should, iangat niyo yung shirt, and then you should place a towel over the area. Place a towel to absorb the sweat. Again, it should be placed perpendicularly and must have at least 1 inch. An inch from the area. Next. So we on the machine and then increase the time. For this machine, it's 20 minutes. And then we turn it on by turning this knob. And always ask the patient if kumusta siya. The heat should be at patient's tolerance. Sorry. Turn the knob slowly kasi sensitive siya. Kumusta? Sige pa ba? Okay na. Increase pa ba? Okay na. Good. Leave the patient, okay na? Or sabihin pa yung 25 minutes. Good. The treatment will last for 20 minutes and check every 5 minutes. Turn off. Hit mo lang hanggang marinig yung click. Then, off.